think it's kind of the basics that appeal to most people. So where are you going to raise your family? And how is your family going to do being raised in this area?
I think Dubuque's a great place to practice. It's a community where you see your patients in day-to-day settings, which is kind of neat. You see your colleagues frequently, and I think because of that, it's a fun place to practice.
I grew up in a big city. Dubuque is the smallest place I've ever lived. And we picked Dubuque because for a town its size, it had much, much more to offer than other towns its size.
We wanted a mid-sized town that had kind of the community and feel of a smaller town and some of the amenities of a bigger place.
I trained in Germany, and so I came in pretty new to the culture in Iowa to begin with, and then 9 years ago to Dubuque as my new home. It's not that you have to go to a big city or crave all these cultural things. You have them right at the tip of your hands. You're a water person, you go on the Mississippi. You are a ski person, you go there, you can snowshoe, you can hunt, you can hike, you can bike. And most nicely is, it's very easy to find friends in that community.
I think the school systems are fantastic in Dubuque. Both the public and the parochial schools do an excellent job. In terms of education standard, Dubuque always ranks close to the top, if not the top in the state of Iowa.
It's a small community. We are neighbors with each other. Our kids go to school together. You know, we take care of each other's family members. You're all part of the same community.
I think that's one of the best advantages of working in a multi-specialty group that Medical Associates is, because there's the proximity of other physicians. So when I have a question about a patient or they have something they need from me, I can literally walk across the hall and talk to a pediatrician or talk to an internal medicine doc, whoever I need for that patient.
And we learn from each other, we educate each other, we do things together and we grow together. And I think that kind of culture, a very collegial culture, a very collaborative culture, makes it not only professionally very satisfying, but actually a lot of fun.
Well, you know, what's good about Medical Associates is that it's continued to value physicians and patient-centered care. That has not changed.
I think Medical Associates tends to be very progressive when it comes to doing what they can to try and improve patient care and trying to be on the forefront of improving patient care, whether it be building new buildings, new technology, new surgical equipment. I do feel that Medical Associates is on the cutting edge.
We provide you with an excellent opportunity to perform your specialty. Colleagues are very friendly and approachable. I think that the reimbursement is very good. As far as the job is concerned, I liked being in a multi-specialty group. We're all shareholders, we all have a say in how things go.
When you become a shareholder, you become part of a group that shares the profits of working in such an organization. So the other benefit, I think, is that the physicians that are shareholders together really are invested in each other.
If you want that one-on-one patient relationship with a supportive and independent, not hospital-owned practice, this is the right place. And that's what I wanted, and that's why I came here.